It is Medical Monday. I'm Lisa Carberg, and we're talking about November is Lung Cancer Awareness Month. And Dr. Brian Whang is with us. He is with Hartford HealthCare. He is a lung expert and a surgeon. And Doctor, welcome. Thank you for being with us.
No, I'm happy to be here to talk about this.
So, Doctor, tell me about where we stand in the U.S. with lung cancer compared to other cancers. Give us an overview.
Well, we have some work to do, frankly, although we've made some progress. We don't tend to get the same exposure that breast cancer does, for example, but we're trying to spread awareness. Uh, Basically, there's a population that needs screening. We have a very good tool, and unfortunately, a lot of people don't know about it.
What is
In
the
fact,
tool? It's not the old X-ray, correct?
that's right. It's a low dose CAT scan of the chest. And by low dose, I mean amounts of radiation so low that it's about the equivalent of about 7 transatlantic flights. Or if you live in a high elevation area like Colorado, um, about 2 years of living at those heights.
Oh,
So,
interesting. And doctor,
yeah.
we just put up on the screen. Now, we'll be talking with Inez, your patient, in this presentation as well. But I was
Mhm.
at your office and you showed me this. And now hers presented, she was getting treated for breast cancer, and then they detected something on her lung, which you were showing me here. Tell me what we're looking at.
Over on the left side of the screen with the little marker there, it says 9 millimeters. That's her lung nodule. It's a spot on the lung that shows up on a CAT scan is kind of whitish. And in retrospect, they'd seen that she'd had that nodule. And there, with the arrow, you can see how small it was a few years ago. Yeah, and putting it all together, we realized this is something that needed to be taken care of.
And she really got lucky that it got picked up in her breast cancer screening, correct?
Kind of. She actually, undergoing surveillance for breast cancer screening, certainly, but I think what prompted that exact scan was abdominal pain. And,
Ah.
and there I'm circling that other part of the CAT scan. That's her stomach, which is in her chest. She's got a different problem there too. But yeah, it was kind of a lucky thing to kind of catch both, so that we knew what to do. We had to sort of triage the more important matter, which for her in this case was something that very much looked like a lung cancer.
So what did you do? What were the steps? How did you treat her?
Well, she underwent a workup for her overall health, because one of the potential treatments is surgery, and radiation's another option, for example. But we indeed embarked on surgery because we deemed it to be a localized enough cancer, probably a stage 1. And in the end, after we did the surgery and whatnot, we did confirm that we caught it early enough to call it a stage 1, and early stage 1 at that too.
Wow.
And I was able to do what's called a segmentectomy, in a minimally invasive fashion, so that small incisions were made. It helped to potentially speed up her recovery,
Where do you
rather
go
than
in for that surgery?
through the side. We go
Okay.
between the ribs with these ports and a camera. Yeah.
Okay.
And the nodule is located in her right lower lobe, which is the biggest lobe in the body. But as I said, only a segment had to be taken out. So we were able to spare 4/5 of that largest lobe.
How were you able to biopsy that? Explain what you did.
Ah, there are different methods of biopsy. In that particular case, we did not do a biopsy per se. The surgery itself was the biopsy.
Gotcha.
Sometimes we stick a needle in it ahead of time using CT guidance. A specialized radiologist does that. Other times at the time of surgery, we'll just take out that little portion of the lung and then get a preliminary diagnosis while the patient's still asleep. And if we confirm that it's cancer, then go on to do the slightly bigger operation for cancer. But in that case, we went straight to the segmentectomy because it was kind of in a difficult location to do that other form of resection that I mentioned. You really did have to kind of carve out the individual structures that go to that area to really get the purchase on the lung tissue with these staplers that we use. So we went ahead straight to the segmentectomy, also because of the high suspicion that it was going to be a malignancy. So we sort of saved her that step, but also just from a technical standpoint, it made more sense to just go straight to the segment. And yeah, confirmed that it was cancer. Did a few additional things like removing some lymph nodes in the chest. That goes into the staging process too. And fortunately, there were no cancer cells in those lymph nodes either. So
Wow.
you combine that with the size of the tumor that they determined to be less than a centimeter, the preoperative imaging that didn't seem to show that it was anywhere else in her body, and we can kind of confidently say that she caught her cancer early enough as a stage 1A, it's called.
And now do you have follow-ups with her?
Indeed. She joins a club, a robust club where we do surveillance using CAT scans again
Okay.
um, to check for recurrence. And it's pretty frequent during the first few years when the chance of recurrence is higher, and then we start to space it out as we get more time under our belt.
All right, and we have one more minute left in this segment. Can you explain the advantage of a CAT scan over an X-ray for people who might not know?
Well, it gives you a lot more detail. It uses the same type of energy, which is radiation, but it's very sophisticated. It uses a computer to recreate the data and give you a very fine picture with precise images. So you really need that level of granularity to catch small nodules such as Inez's.
I'm Lisa Carberg, and for Lung Cancer Awareness Month, we've been talking a lot about the symptoms, who should be screened, and I'd like to introduce you to a patient right now, Inez Napolitano. She is a Connecticut resident, and your lung cancer was kind of discovered by accident. Tell us briefly about that.
Well, because I was having problems with my stomach and my cancer doctor, she sent me for additional x-rays, and that's when she found the nodules. And she in turn sent it over to Dr. Whang immediately.
And you were being
Uh,
treated for breast cancer, so that was it was detected in something like that. What was your reaction when you found out that you had something in your lung?
what are you going to do? You roll with it. You roll with it and you don't worry about it. There's too many other things out there to worry about than worry about that. And if you've had it once, you're okay.
And you chose to go you had options of radiation, but you wanted it removed. You wanted to take care of it. Tell me about that.
Well, the thing is, having survived cancer once already, the last thing you really want to do is radiation. I would much rather take my chances, see if they can get it all, and go from there. If I have to have radiation afterwards, I would. But if you're lucky, you can get it all in one shot.
And how was I know you've been through a lot, with health. How was the lung surgery?
Actually, it was great. He told me I'd be out in 3 days, and I was. So, and then the recoup time, I had two lung infections afterwards, but that's because my great grandchildren came over. I got lucky.
So how are you feeling now? How's your life?
Oh, well, let's see. I had another surgery 2 weeks ago on my stomach. So right now we're sitting back, we're relaxing, taking everything one day at a time.
And did you ever have any kind of lung-like symptoms, like
No,
coughing or anything? No?
no, nothing that showed. It's just that Dr. Jandal kept on top of everything. Anything she didn't like, she sent me right away for tests.
And it's good to have a doctor with a good rapport like that that really looks out for you. That's an excellent point. And tell me about your history. Now, you were you ever a smoker?
No, I never smoked, nothing.
And now that you do not have the lung cancer anymore, that tumor in there that was we saw was 9 millimeters it grew to. How are you feeling? Are you relieved? Tell me how you're feeling now.
It feels great because you know what? It could have been worse. So they took part of your lungs, they took the cancer pieces out. We hope they got them all. And with any luck, they will be gone. But in the meantime, you got to go day by day and just enjoy what you've got. And you've got so much, you don't worry about it.
Your outlook is so good. Has this been your outlook through the breast cancer as well?
Yeah, it has to be. I've got too many people, friends, family, everyone. If you're down, they're down. And if you're down, you can't recoup. So you've got to look at everything. And no one ever said to you, life is going to be a bowl of cherries. There's a lot of pits in there. So you've got to go take the pits with the cherries.
Inez, you are an inspiration, really. And I hope people watching this realize be vigilant, go to your doctor when they tell you you need a scan, get the scan, right?
Oh, definitely. That's what they're there for. And when you find a good doctor, you stay with them because if you don't, you will regret it. There's a lot of doctors out there who do not take the time or care. I know because I've seen a lot of them. But when you find the right ones, you stay there. And when they refer you to someone, you go to them. Because if your doctor's good, the referrals are going to be the best.
And tell me your thoughts on Dr. Whang.
Oh, I love them. I really do. When Dr. Jean Dahl said to me, Inez, go to Dr. Whang, you're going to love him. And when I went to him, he was very, very good. He didn't pull any punches. He told you exactly what you were looking at. He told you exactly your options. So, and you need that up front. You need to know what you're getting into. You need to know what could go wrong. And if everything goes right, it's peach. If it's not, you need to know where you're going. And he's great at that.
And we should say Dr. Whang is with Hartford HealthCare. He's a thoracic surgeon. Lungs are his specialty, but he's also in charge of lung cancer screening. And the rate in Connecticut, the screening rate, it'll never be up there with breast cancer, but we've gotten it up to the second in the nation, he told me. And he is working so hard to try to get the guidelines changed so more people can get screened and have it covered by insurance. So his passion for this subject is just, I found it to be very amazing. And to meet you, one of his patients, who, your lung cancer may have been found accidentally, but he guided you, you chose an aggressive course, and he caught it early and you're cured. Isn't that amazing?
It is truthfully. And because I've been involved with the breast cancer and a lot of the companies and different, like the make boys and girls clubs, all of them, they do the breast cancer, but now they're going to shift into doing the awareness on the lung cancer. And that's all of them in Connecticut because I'm affiliated with them all. So we're going to push this. We want people to know. We want people to get tested. We want people to keep up on everything. So there's more than one cancer. So you've got to know about them all and you've got to do your homework.
Tell me how you got involved with those organizations on getting education out at an early age.
Well, for the one thing is with the Boys and Girls Club, I've been involved with them for 18 years. I and the Make-A-Wish Foundation, all of those, mainly because of my business and because you donate time to them. And the kids in these Boys and Girls Clubs are great. And every year October is for the breast cancer, and now they're going to be working on the lung cancer for November. And I've taught there for 18 years. I volunteer my time. I teach crocheting there, and I
Oh,
teach it in 3 of the other clubs. And the kids there, they go all out to raise money for everything. And this is going to be one of their top ones too.
you are a really special person. That's really amazing. What town do you work in? Which Boys and Girls Club?
My home base is in Shelton, but I'm also Derby and Stamford. In Shelton, we have the Boys and Girls Club. We have one in Derby. Aunt Sonia that takes care of all the schools there. We have one in Waterbury. We have one in Stanford. The Stanford one, some of my best friends are there. And they in turn teach the kids about cancer. And the kids in turn, when you teach a kid something, they go out and they tell everybody. So you start with the kids and you work your way up. So it's a great way to advertise the cancer because then the kids aren't afraid of it and they can see that you can win it. And that's important for kids to know that it can be beat, especially with so many children that get cancer.
Well, we're seeing an incident. I just did a whole special report this spring on the number of young people who are getting more cancers, colon cancers, all different kinds. And it's a real problem in the US and it's very dangerous. Inez, thank you so much for joining us. I really appreciate your time and to find out that you are a treasure in our state
Oh, thank you.
with giving your time to young people, whether you're volunteering or working. That's a very special place in our heart. You're amazing. And continued good work and continued good health. And thank you again for sharing your cancer journey. And we're just so happy for you.
Thank you. I appreciate your time.
Thank you. We are with Dr. Brian Whang. He's with Hartford HealthCare. He is a lung surgeon, and we're talking about Lung Cancer Awareness Month. It's November. Doctor, tell us about lung cancer screenings. Who should get them? When do you get them? Give us all the information.
Well, for now, it's for people with a very high risk of cancer. The research that went into the screening criteria is based on smokers with a certain history of smoking too. So the criteria consists of age between 50 and 80, a smoking history of what they call 20 pack years or more, which is the equivalent of smoking 1 pack per day for 20 years and either currently smoking or have quit within the past 15 years. These are for people who don't have symptoms, okay, because it's a screening tool. We're trying to catch people who have the risk factors but aren't necessarily showing signs of lung cancer. And by doing that, we hope to catch them early. And when we catch them early, it's more curable.
How do you
So
reach these people?
Well, we're trying to do a lot of outreach directly to the public. The American Lung Association, for example, has a very strong campaign, in particular this month, since it's November, Lung Cancer Awareness Month. But we're also spreading the word through primary care doctors and other doctors so that they can tell their patients. We're trying to do a better job of linking it together with people who take care of people with breast cancer, because that's an important population to look at too. And I'll point out that lung cancer is the #1 cancer killer. If you combine breast cancer with prostate cancer and colon cancer, lung cancer unfortunately still um, um, causes more cancer deaths
I was
altogether.
surprised to hear that. That really blew me away. That is very eye-opening.
Yeah,
And you don't have to be a former smoker or smoker to get lung cancer, correct?
that's correct. 20% of people who have lung cancer have no smoking history. Um, we still need to do a better job of elucidating what risk factors might lead to a low dose CT in those individuals. But for now, it's based on smokers. But even with what I told you as far as the criteria, we're expanding that. We're trying to reach more and more people who certainly do get lung cancer. For example, we're trying to eliminate the criterion of quit date, because we found that any significant amount of smoking gives you a kind of a lifelong risk factor.
Ah.
Although if you quit, I mean, by all means quit. After 10 years, your risk is cut in half, for example, but it's still there and it's significant enough so that we still want to have lung cancer screening for people, regardless of their quit date. And we're also looking at people who maybe don't smoke up to a pack a day for 20 years. We found that a lot of people still have that risk with 20 years of smoking with less intensity. In particular, we've looked at the African American population who are unfortunately underserved by the current criteria. So we're trying to change things to reach more people.
Doctor,
Lung
is it
cancer
covered by
screening,
insurance? Are these screenings covered by insurance, or can people get coverage?
if you hit the criteria that I
Gotcha.
mentioned.
Gotcha.
Yeah.
Okay.
Yeah. As we expand the criteria, we hope to get buy-in from Medicare, which then will lead to the insurance companies also paying for it.
Excellent.
But
Well,
now,
keep up the work.
thank you. Thank you very much.
Can we talk
Yeah,
about the symptoms? You had mentioned that Inez had she had she had a pain, a stomach pain. What are the symptoms of lung cancer?
yeah. So that led to an incidental finding, but things that should prompt a CAT scan of the chest to potentially narrow down a diagnosis of lung cancer might include a chronic cough, coughing up blood, chest pain, um, recurrent pneumonia, um,
Oh,
uh,
okay.
difficulty swallowing, um, loss of weight, loss of appetite that you can't explain, So those are some concerning things that would prompt a visit to your doctor and probably a CAT scan, at the least a chest X-ray. Um, but strictly speaking, those are the people who would not undergo lung cancer screening.
Interesting. So I guess like you said, widening the screening criteria would bring a lot more people into the tent to get coverage and get these screening tests.
Yeah, the earlier studies showed that we decreased mortality by 20% or more. And you got to keep getting the scan too. Don't
Ah,
just do it
okay.
once. You're not one and done. It's every year, and we catch more and more as you stick with the program. So other studies have shown almost a 40% reduction in mortality if you keep up with it.
And how are you able to catch these early, or is this one of those cancers that progresses before you catch it and then maybe it's pretty far gone?
Yeah, that is the reputation that lung cancer has. And unfortunately, when you do present with symptoms, you do tend to present in those later stages. But yeah, that's the beauty of screening. We do catch them more often at an earlier stage. And we're doing a pretty good job of that so far. Surgery is a very good tool, certain forms of radiation, another very good tool for early stage lung cancer. And I'll point out that here in Connecticut, we're doing a pretty good job too. The American Lung Association publishes like a report card every year. And we are doing pretty well with, for example, lung cancer screening. We're second in the nation. Um, though our percentage is 27% of eligible patients are being screened. It's kind of a low number, but we're doing so much better than we were a few years ago when we were in the 6% range.
Hey, second in the nation? That's pretty darn good. And it sounds like you're trying to grow that.
Yeah, I'd like to think that we're leaders here in Connecticut, leading the charge, but 27%, that's a very low number. And, just for comparison, it's in the 70% range for breast cancer screening.
All
Um,
right, we are out of time. Dr. Brian Whang, thank you so much with Hartford HealthCare for sharing all of this potentially life saving information and keep us posted on any changes to the guidelines and other new developments. We appreciate your time.
oh, I'd be happy to. Thank you very much.
Thank you.